put your boots, we're going out tonight.
It was quite clear that from the ANC policy documents, the ANC health policy document, which was released in 1994, and from the Reconstruction and Development Plan, which was the program of action, also released around about that time, that the ANC had a very strong commitment to safe, legal early termination of pregnancy. And so we knew that we were working with a government that was recently in power, that was on our side. And in the change of government, there really was a window of opportunity. And what I talk about was soft boundaries. Things were very soft. One could network, one could move, one could phone up people in Parliament very easily, one had connections. There was a huge amount of goodwill and trust, particularly amongst the women's health movement. In 1995, I think in about May, they started to have hearings, and we were involved in monitoring those hearings, in making sure that women who had been part of our Women's Health Policy Conference in 1994 were able to come to Cape Town to address the parliamentary committees. A very difficult experience, perhaps for the first time getting on a plane, first time being in Cape Town. For many women, it was the first time they were talking about abortion and the fact that it's okay and this room is safe. And how do you feel about this? And what do you think should happen?
It's a good act, but the implementation of that is not that good. Why? Because most probably because the initial work onto that act wasn't enough. People weren't prepared well enough for that. The country at that moment in time maybe wasn't that ready for this type of act.
Laws may be put in place, but that does not mean that they trickle down to the community. Public hearings may have been held, to get consensus around issues of abortion, but that consensus may not necessarily have been representative and cannot be representative of the entire nation. Just for example, with the Same-Sex Act, for example, a large percentage of the population is against that, but there is a law in place, you know what I'm saying? So I think it's often about that there's a framework within which you can go to, within which you can defend yourself, within which you can find some sort of support if you get a backlash from the community.
We have a health department that's not very engaging and not flexible, and what I know now is the context of hard boundaries. And so at that time I talk about soft boundaries. This is a period of hard boundaries. To have a meeting, to negotiate, to kind of talk about, political opportunities, engaging with parliamentarians, it takes 3 months to organize. There it would take 5 minutes.
the first year or so was difficult because people had to get to terms with this. Doctors used to often made remarks, about nurses wanting now to perform operations, because you must remember this is the first time that ever a nurse was allowed to actually perform a surgical procedure.
And there's no reason why a qualified, trained midwife can't perform an abortion as safely as a doctor. A first trimester, there's no reason why they can't. They do lots of other medical procedures.
I know that those doctors and a lot of my supervisors at the hospital, all of them were waiting for me to fail, for something bad to happen, so that I could say, we told you so. We told you that this service is not for nurses.
What emerged to me when we were doing this big study was that even though we have very liberal legislation, there were still tremendous problems with actually having people to provide the services. So it's all very well having a really liberal, progressive legislation on paper, but in terms of implementing the policy or implementing the law, there's huge problems because there just are not doctors or nurses to actually do because at the moment medical abortion is not available in the public healthcare sector, so the only abortion available is surgical. So that's quite a problem if you don't have people to actually do the procedure. There's no emotional support, they're rude to the woman, there's no privacy, confidential, certainly no privacy. So I was quite shocked when I actually saw what was going on.
It's viewed as a success that 60% of the designated facilities are working. I mean, it should be 90% is viewed as a success, not 50 to 60%. There's still facilities that are not up and running. The implementation of medical abortion has taken about 4 years. I mean, the guidelines have been written. There was supposed to be a meeting last week. It was cancelled. It's not happening. There isn't the kind of energy that there was.
It was quite amazing. I mean, obviously providers who were nurses and doctors that were involved in abortion care in some way were familiar with the new legislation, but those people who had chosen not to, they would work in a facility that maybe did abortions, but they wouldn't be involved at all. They just wouldn't even make a cup of tea for the person. They wouldn't be involved. They didn't even know much about the legislation. They still thought it was like before, where you had to get doctor's permission and this and that. So it was quite shocking. They were working in a facility, they didn't actually know the new law.
Every right in that constitution is not absolute. It is always limited if it's justifiable in an open and democratic society. So I think it is justifiable in an open and democratic society for a woman to have a termination of pregnancy. So you just have to weigh those rights, like what is important more than, is it the right to religion or is it the right to have reproductive right for a woman?
Some of the nurses really have a huge problem, say they're being ostracized by their colleagues. They're not allowed to go to church anymore because they call them murderers. They call their children at school are being bullied, and they tell them your mother is a killer.
I went to my minister. I didn't tell him that I'm busy with it, doing the service, but
Really scared.
I just asked him, what does he think about this? Because I'm not feeling comfortable, and it's against us, our religious, and he would suggest me not to do it. On the other hand, you see, they don't have anyone, everybody's refusing. As I said, the service must go on. There is people that you must help, and that's maybe the reason why I'm doing it. I don't know. I would say maybe I'm confused.
We did have nurses who said that they personally, the reason why they had become involved in abortion care is that they personally had either they or a friend or family member had, needed an abortion, and they'd been personally involved in some way, or whether it was a patient who had died, or a daughter or somebody who needed an abortion, maybe they themselves had had an abortion.
Basically, it started when I was very young. I was still a teenager and felt pregnant. Wasn't ready to be a mom. Then, unfortunately, I tried lots of things. Friends would say use this, and the other one would say use that. And one would say take lots of aspirin. You try that, doesn't help, and you just become hopeless. And one would say there's a nurse that stays in a certain area, go and visit her, and you go there, she's out of town. And you keep trying until you just lose hope, because you try until, while you're still looking for this hope, for this help, time is actually flying, When I see a teenager who's actually pregnant and is not ready to be a mom, I understand what she's going through.
It's against my religion for me as a person to go for an abortion. But it's not, for me, it's not like illegal or against my religion to help somebody. For me, it's the same like giving a tablet, like a high blood pressure or any other tablet or any injection to somebody. You're helping the person. I'm doing it in my workplace and I'm covered. So I don't feel guilty or anything.
There's a huge number of second-term clients, which for us is worrying because it means that they have waited too long. And why is this?
If you don't know the actual law, then it's a problem, because then they refer somebody here, and then they get referred back there, and then they get sent there, and then they get told to go there, and so on. And by the time they actually see somebody, they're very quite advanced already in the second trimester, so that's obviously not optimal.
I think for the rural population, access to facilities where abortions can be done is limited, and that people have to travel far. We get clients from the Eastern Cape and so on that would come here specifically, and then often they are late. That also move into the second trimester because they couldn't access a facility, in the rural area.
I would say in the rural areas they do anything to access the contraceptive. Sometimes they go to clinics. You hear stories like they have to walk about 10 kilometers or even more, to get to a clinic, to a point where they can access the contraceptive. You will understand that in those areas it's either an area that will cover 5 different villages, has got only one day hospital, and obviously they are overstretched, and some of them don't even know about the fact that they can go there.
It was awful for me. I still don't think I've really been able to deal with the intense anger and sadness that I have felt that, it's mixed up with feelings of working still in a hospital that was segregated, where black women had poor services in comparison to white women. And when I only saw black women really coming in for for illegal abortions. These women would come in after a weekend and they would have fever, they would be very, very ill, they would have a very hard abdomen because there was an infection. They would need to go to the theatre and be put on antibiotics. Some of them needed to have a hysterectomy. And nobody ever taught me as a nurse what actually was happening then. They were seen as dirty and they were seen as naughty. I think, given the context in South Africa, it was really important to have black women speaking out about the injustices of not having access to abortion, because as a white woman and as a wealthy woman, one had recourse even under apartheid. You know, the previous act, you know, one could say one's suicidal and go to a psychiatrist and then get a termination. But what needed to be emphasized was black women that were suffering, and black women that were obtaining illegal abortions, that were poor for their health, dying. And the Medical Research Council research indicated that there were 425 women estimated to die every year from backstreet abortions.
I stopped getting my period, and then, but I didn't even notice, honestly, I didn't even notice that you know, my period is going and all the symptoms of pregnancy, I didn't even notice it. And then I just saw my stomach started getting hard, but I didn't even notice that. My stomach just looked a bit big once, and looked and I looked, and I was like, oh my God, something is not right here. And then I told my cousin, I told my grandmother, I told her mother, I told my grandmother, I told my grandfather. They shut me up the house. It's like a mall, it's called the Golden Acre. And that mall, and I sleep in front of the doors, it's like down escalated. It's horrible, it's extremely horrible. Half the night I have to lay like with my one eye open because I have to like be sure about who's coming, you know, but I've been, you know, again, right? And being harassed and stuff by the guys here at night. It's terrible in the daytime walking around like this, and sometimes I get so tired I just want to like go sleep or take a nap. Like being pregnant, you just want to sleep, and I can't even sleep because I don't know where. So sometimes then I sit on the side of the pavement and I just like put my head down and close my eyes for a while. Sometimes I just wish I was dead, you know. It's horrible, seriously. And when you ask people for money, they are so rude. They will like shunt you or give you the hand. It's horrible. I can't give a baby a life on the street. I can't. How am I gonna do it, you know? Go to look for a job with a baby. People's not gonna give me work. If you go to a clinic here, you're pregnant, right? The nurses, they will be like, you know, they'll scull you out and swear at you, and I don't know how to. They're rude, the nurses. They'll ask you, say, if you want to go to a clinic and you want to go on to the contraception, the nurses will ask you why you're so young, what are you having sex for now, this age, and that's what I'm scared of. I would even do it on my own. like maybe like hang a rope around my stomach or something. And I know this sounds harsh, but yeah, it's my only way out.
The thing with clients is that they are very vulnerable. They want to keep it a secret. They don't want other people to know, and therefore they are not big on standing up for their rights.
I think a lot of black nurses, equally so white nurses, have problems with abortion because it's the same old religious, moral issues about killing a baby, etc. And very few people are catered within the reality of that. For many women in this country, consensual sex isn't even an issue. The inability to negotiate safe sex, high levels of rape, incest, sexual violence in this country. I mean, people don't even begin, those are the issues that people don't really look at. And the abortion-related morbidity and mortality that resulted, as a result of unsafe abortion. So, forget all the... People always see it from a moral kind of perspective,
Pro-life people are very strong in universities, and those doctors for life usually came in touch with pro-life people in their first year at university already. So they've been fairly well indoctrinated as well.
The kind of right-wing Christian continuum that one is so familiar with, they would be anti-communism, they would support the death penalty, they would be opposed to abortion, anti-pornography, anti-sex worker. It's just one, you know exactly what's going on in their head. But at the same time, what was very, very critical at that time is that they were also supporting what could almost be argued as terrorist organizations that were undermining the liberation struggles in Mozambique and Angola. So that was quite important to acknowledge. There was a group called Frontline Fellowship, that was handing out a Bible and a gun.
We also have a political party that's very anti-abortion, for instance, the African Christian Democrats. There's various factions, but they have no problem working together to obtain a goal.
In terms of enshrining it within the Constitution, enshrining it within, the legal framework, it would be seen as a Western thing, but I'm sure that people have been doing abortions all along. I know that it has been happening, only that it's not been spoken about very loudly. But it has been happening within African society, so one cannot say that it's an import from the West. Women have been making choices, and they have been making those choices silently.
Many men seldom find out much about abortion. If they do, they discover after the abortion has taken place. And therefore it's usually considered to be, some men actually consider it to be a woman's affair. Private.
One of the easiest ways in to get people talking about the issue of abortion would be to choose the easiest route, which would be to talk about the health issues related to women. That would be the easiest way to get communities to even begin to talk about abortion as a choice.
Between our service as an NGO service, free of charge also, to an abortion service of the state is in the way we work with the client. I would say our service is much more friendly, less judgmental. The quality of the service is very high. People would make an appointment here. They don't sit at a clinic for a whole day and then not get service, or sit at a designated area within a clinic where everybody knows why you're there. And it is linked to quality intensive counselling. So, and I think very often at facilities where there are a lack of staff, the counselling doesn't get attention. And here we open options for the client. We talk about why she's here, why has this happened, how can we make sure that this doesn't happen in future? What are the other options, and is she sure that she wants to do this? And when she is fine and comfortable with that decision that only she makes, then we would book her for the procedure. And we try to bring in the partner also where we can. We like the partner to come with on the day of the procedure, and then after the procedure we have a short post-counselling session again, just to make sure that this client is fine, and then just to say to her, whenever else she wants to talk about this, she is welcome to come to Mosaic.
We have had the impact of the Bush regime, in a sense, on South Africa, where funding has been shifted from donors, instead of coming around women's rights and to Iraq. Also, funders have had key constraints where if you work on abortion or if you work on homosexuality, you basically don't get given funding anymore. I mean, the traditional groups of the United Nations Population Fund just dried up in this area.
It's also difficult because I know that the Planned Parenthood here, the Americans reduced their funding a lot because they were talking about abortion, they were referring to it. So that already had an impact on it.
It's quite clear that in South Africa at this time we've got a very worrying understanding. In 2007, it's not a happy marriage, women's rights and human rights. It's not a very clear link.